This week, we are going to begin discussing how mental health information is shared with others. We will examine one model of disclosure that is useful for understanding how we disclose private information to others. Then we will outline the implications of that disclosure interaction by taking a close look at the role of the recipient in this conversation. Individuals, especially college students, report various reasons for engaging in the disclosure of their private mental health information. For example, college students may be motivated to disclose their mental health status with friends to strengthen the relationship because they feel the other has the right to know, or because they need a person to vent to. It is also possible that disclosures may engage in unplanned disclosure of mental health information. For example, if a college student experiences symptoms of their mental condition that influence their behavior, these changes may be noticed by a close friend or roommate. The close other may ask about these behavioral changes, prompting the person to engage in spontaneous disclosure. Or in a less desirable scenario, the friend may call out the disclosed individual, which may prompt them to share out of defensiveness. Disclosures of mental health information take many factors into consideration when they are deciding if, when, and how to disclose private information about their mental health. Similarly, they often have the option to prepare for and script for these disclosures. One model that helps illustrate the disclosure of private information is the risk revelation model. The risk revelation model of disclosure focuses on the disclosure of private information or secrets. The authors of the model argue that disclosing private information poses potential risks to the person sharing, the recipient of the information, and for the relationship between the two. The model starts with an assessment of a secret or private information. The valence of the secret predicts the degree of risk that people feel for themselves, their relationships, and other people. Negative secrets should be associated with greater risk or stronger concealment of secrets. Another way of thinking about negative valence would be information that is highly stigmatized. The valence of the private information then determines the level of risk that is assessed by the disclosure. Risk assessment is the extent to which people assess the severity of the risks involved in revealing their secret to someone. Revealing sensitive information about oneself is risky, thus boundaries are created as a means to regulate the amount and type of information to reveal to others. The risk of assessment is lower when people trust the recipient or they believe the recipient will respond positively. The risk revelation model suggests that the risk of revealing prepares individuals for potential disclosure or predicts their lack of readiness to disclose. As stated earlier, there are certain conditions under which people are willing to reveal their private health information. In the risk revelation model, there are three primary conditions under which people might consider revealing their secret. Catharsis, feeling that the recipient needs to know or has the right to know the information, or that they were prompted by others to reveal the secret. The final factor that influences whether a person will reveal or conceal private information is their ability to or efficacy to do so. Communication efficacy concerns the disclosure's belief in their ability to actually communicate the secretive information to someone else. The RRM suggests that the person's assessment of the risk of revealing the secret should affect their perception of whether or not they believe they can reveal the information. When risk assessment is high, people should feel less confident and perhaps result in the person concealing their secret. If people determine that their information isn't too negatively valenced, have a willingness to reveal the information, and feel that they have the ability to do so, then they are more likely to share that information to close others. There are several strategies that the risk revelation model suggests people most often use when disclosing private information. The risk revelation model also predicts the strategies people use to reveal their secrets. The risk and communication efficacy components are the most influential in predicting these strategies. The strategy of preparation and rehearsal occurs when individuals plan for and practice disclosures. This strategy may help disclosures feel more comfortable and less uncertain during the disclosure interaction. Also, when individuals have a decrease in communication efficacy, they report more planning efforts. Directness occurs when individuals initiate disclosures or respond to direct questions about the information, often in face-to-face contexts. This strategy allows for increased opportunity for dialogue, observing others' verbal and nonverbal reactions, and the opportunity for question asking. Directness has been linked with higher levels of communication efficacy. Third-party disclosure occurs when someone other than the information owners share information with recipients. Third-party disclosure may be an attractive strategy when information owners know competent others who are willing to disclose for them. This strategy is often associated with decreased efficacy. Incremental disclosure occurs when individuals share the least threatening piece of information first to test the other person's reactions, and then determine if and how much to share in subsequent disclosures in order to minimize negative reactions. This strategy is associated with decreased efficacy. Entrapment occurs when individuals disclose as though in an argument and feel forced to share the information, such as correcting another person's incorrect assumptions about their mental health status. This disclosure approach may occur when individuals did not plan to disclose the information or felt compelled to disclose when they were not yet prepared. Finally, disclosure using indirect mediums occurs when individuals disclose information through a mediated channel, such as email or text message. This strategy allows disclosures to create messages without being present when recipients receive them. It also may violate recipients' expectations, as individuals often prefer to receive information in a face-to-face context. The strategy that is used to disclose may greatly impact the response of the recipient of the message. It is important to consider how the recipient responds to the message when examining mental health disclosures, because the response can have implications for how to evaluate the disclosure, how the disclosure feels towards future disclosures, and the well-being of the person disclosing the information. Recipient responses can range from acceptance to rejection. As you see in the study in your reading, acceptance messages are represented in more supportive responses, while less supportive responses such as topic avoidance signal rejection. Positive disclosure experiences promote enhanced psychological benefits for the disclosure, such as reduced fear of future disclosures and increased well-being, while negative responses may inhibit future disclosures. The evaluation of the recipient response may influence disclosure's future goals of revealing or concealing information, with negative responses often hindering future sharing. Furthermore, negative responses may lead the disclosure to feel stigmatized, resulting in feelings of embarrassment, anxiety, and isolation. In the research presented in your reading, we find that perceptions of the recipient response as either being positive or negative influence disclosure and recipients' ratings of the effectiveness of the disclosure interaction. Specifically, a more positive, supportive response was linked to disclosures having higher ratings of effectiveness. Also, negative responses like topic avoidance were associated with less effectiveness. Similar results were reported for the recipient reports of their own evaluations of their response and the effectiveness of the interaction. Overall, this research demonstrates that from both disclosure and recipient perspectives, the perception of whether the recipient response was positive or negative influences their ratings of how well the interaction went. While the literature and models of disclosure have thoroughly documented considerations of the disclosure of private information, it does not fully consider the role of the recipient. One model of disclosure, the disclosure of decision-making in a single episode model, does take into account the transactional nature of disclosure and includes the recipient's role. This model suggests that the disclosure elicits both disclosure and recipient behavioral, emotional, and cognitive reactions. How the disclosure is managed and how the dyad interacts after the disclosure both have relational implications for the people in the conversation. Research that does examine recipient experiences of private disclosures show that often recipients are unsure of how to appropriately respond to a disclosure, which can lead to less than optimal responses to that information, such as those that can reflect stereotypes and stigmas. Furthermore, the research shows that the role of supporting the disclosure can lead to personal distress for the receiver. Thus, this research demonstrates that receiving a disclosure or comforting the disclosure can be mentally and emotionally taxing, even when the interaction could be considered successful. As I discussed earlier, the role of the recipient's response has an impact on both disclosure and recipient ratings of whether or not the interaction was successful. In an extension of the risk revelation model, research has examined how disclosure ratings of closeness with the recipient, or how satisfied they are with the relationship with the recipient, influences what strategy they select for the disclosure of their mental health information. Specifically, the closer the disclosure feels with the recipient, the more likely they are to select the strategies of directness. Conversely, when recipients report low levels of closeness with the recipient, or they are not as satisfied with the relationship, they are more likely to select the strategies of indirect mediums and third-party disclosures. The strategies of participation and rehearsal, incremental disclosures, and entrapment have not been shown to be related or impacted by relational closeness. In your reading for today, you also saw the role of closeness in predicting recipient and disclosure reports of the recipient response and interaction effectiveness. Specifically, disclosures who felt closer to the recipient reported higher levels of interaction effectiveness and were more likely to view the recipient response as supportive. Furthermore, disclosures who rated the relationship as less close reported the recipient response as being more negative in the form of topic avoidance. For recipient responses, ratings of closeness predicted higher levels of supportive responses, but not effectiveness. Overall, we can see that the quality of the relationship can have an important impact on how the recipient response is perceived, which can have an important influence on how the interaction is rated as being either successful or unsuccessful. That concludes the lecture for this week. Next week, we will take a closer look at supportive responses during mental health disclosures.